Wake up.
Speak up.
This is the Battle High School Wake Up Interact podcast.
Our goal is to inform and educate on challenging topics,
while having a respectful and engaging dialogue. Hi guys, my name is Morgan McBee, and I am the head of our podcast committee as well as the vice president of Wake Up.
I'm Sydnee Goings, I'm a junior, and I just started this year because of Mr. Lutchman.
So today we are going to be talking about mental health, what it is, how it affects us, and available resources for taking care of it.
Wake up, speak up, podcast.
Before we begin talking about mental health, let's discuss why we wanted to bring it up in the first place.
So I want to talk about mental health because it's something that plays a big role in my life. It's something that I see around me a lot, and I know it affects people our age a lot, and it's something I'm really interested in.
So I wanted to talk about it. I've seen it affect a lot of my family members and a lot of my close friends, and I personally have struggled with it a lot. I think there's a lot of misinformation and stigma around mental health, and it's super important that people get accurate information around it, as well as I'm going into the neuroscience field because I want to start studying mental health.
You might be wondering, what exactly is mental health, and why does it matter to me?
Mental health is our emotional, psychological, and social well-being, according to mentalhealth.gov. It encompasses a broad scope of our health, and it's pretty much every way that isn't physical.
And it's important because we all have mental health. Whether or not we realize it, we all need to take care of it.
In fact, 1 out of every 5 U.S. adults have been diagnosed with a mental health or disorder. That's 20% of our population.
Mental illnesses can have various causes. For example, its environmental causes include emotional and physical trauma, injury, or abuse.
And you can't forget about other environmental causes like infection, substance abuse, or poor physical health.
There's also biological factors that play a major role in mental health, like neurotransmission and genetics. Most mental illnesses actually stem from problems during neurotransmission.
What is neurotransmission anyways?
Yeah, so it's essentially the communication between nerve cells and the brain. It allows our brain to communicate with itself and the rest of the body. Neurotransmission is enabled by these chemical messengers called neurotransmitters, which have relatively different functions.
Okay, so how do they affect mental health?
Most of the neurotransmitters have effect on mood and emotions, which can directly impact mental health. However, the malfunction, meaning the under or oversupply of multiple different neurotransmitters, can have the same effect as each other, which makes it hard to treat them.
Okay, cool, that makes sense. So earlier you mentioned genetics play a role in this. Can you elaborate, please?
In general, our DNA is really important because it's our genetic blueprint. So it's typically the basis of those neurotransmitter disorders we talked about before. But there's not actually a singular gene for mental illness. Instead, it's the interaction of multiple genes. For example, autism, ADHD, schizophrenia, depression, and bipolar disorder tend to share the same general DNA variations.
And since this has to do with our DNA, that means that we inherit mental illnesses, right?
Not exactly. The susceptibility to mental illness does follow a pattern of inheritance, but we don't inherit our parents' experiences. There are certain examples of gene expression being manipulated by our parents' environment, but similar to cancer inheritance, it's really about susceptibility.
Okay, so for our next section, we're going to talk about how mental health affects us and the stigma about mental health. Mental health can affect our physical health as well. This can be a direct impact by preventing us from fulfilling our basic needs or by affecting our internal mechanisms. So now I'm going to give us some facts about how mental health affects us in our daily life.
The connection is fairly clear as those with mental health problems tend to live shorter lives than those without them.
Mental health and physical health are fundamentally linked. People living with a serious mental health illnesses are at a higher risk of expecting a wide range of chronic physical conditions.
Those with severe mental illnesses are at a 53% higher risk for cardiovascular heart disease and have 85% higher risk of dying from the disease.
There is also a correlation between depression and diabetes, but the exact link is still unknown.
High levels of distress are also associated with a higher risk of dying from cancer.
However, in turn, our physical health and activities can help our mental health. An APA report of the benefits of exercise included lessening anxiety, improving mood, and enhancing mental health. So part of the reason that it's super important that we all do our job in talking about mental health is because that the more we talk about it, the easier it is to admit that you need help. So if you had a broken leg, most people wouldn't be like, oh, I'm just going to tough it out and not go to the doctor. No, you need help and you should get help and you deserve to get help. And mental health is the exact same way.
I completely agree. There are a lot of physical things that can come with mental health, and that's something that a lot of people don't really understand, and so they don't try to get the help that they need.
Yeah, and so that's super important. And part of the problem is that, like, insurance companies aren't really good at helping us with that. They don't normally include therapies, and they don't normally include other resources like that. So, it sure would be convenient if there was somewhere where we could find out some great resources for mental health.
Well, if you stick around, we might have a couple of those thrown in at the end.
That sounds fantastic. Another super important thing to know is that mental health can also affect our grades and how we perform in school. For instance, 17% of youth in America have been diagnosed with a mental health issue, and that is the equivalent of 1.5 times the population of Missouri.
The studies also found that 5% of students choose not to finish their education due to psychiatric disorders, which means an estimated 4.29 million people would have graduated if they didn't have their disorders.
And mental health issues can prevent children from coming to school and completing their work on time. And I've seen this in my own life many times with friends who are struggling.
Untreated mental illnesses can also lead to an increase in suspensions, detention, and other disciplinary action compared to a student's peers.
The problem compounds on itself. Childhood psychiatric disorders are associated with educational failure, which in turn is associated with an increased rate of psychiatric disorders, and both are associated with a range of additional adverse outcomes, including high-risk behaviors and being more likely to enter the criminal justice system. So it's really just a horrible positive feedback loop. Oftentimes in school, it's really hard to be able to experience a mental health issue and still do well in school.
Like, for example, people with depression a lot of times struggle with a lack of motivation. So it can be hard to get things done on time and even sometimes just to show up to class.
So I think this is super important, why we need to look at our education system, and we really need to transform it. We need to work on giving our teachers better education on depression and anxiety and how they can help their students be the most successful, because it really isn't fair. You can't control if you have a mental illness. And so I think everyone all the way around would have a much better experience of going to school if they learned how to properly deal with their mental health, just like we do with physical health with health class and PE. So not only can mental health affect our school, it can also affect how we treat our friends and family.
Mental health problems can lead to feeling of inadequacy and low self-esteem. These things can lead to codependency, which is where one or both individuals in a relationship are overly reliant on the other to complete everyday tasks or not self-worth.
Worsened mental health can increase one's participation in toxic relationships, which stimulates the relentless cycle of poor mental health and relationships.
Mental illness can drive one away from their family and friends, preventing them from having fulfilling experiences and receiving help.
Furthermore, our mental health issues may affect the mental health of any caretakers of ours by increasing stress, financial burden, and their physical health to an extent that they may need help themselves. So me personally, I've seen a lot of mental health issues in my family, and I've experienced it a lot myself. So you see a lot of these outward symptoms of depression and social anxiety, of them pulling away, and it can be really difficult because you really, really just want to help them because you love them and care for them, but it's not always your position, especially if it's a parent struggling and you're the child. It isn't the healthiest for you to try to fix the problem.
I see this a lot too. Like, for example, if someone's struggling really bad, and it can take a big toll on your mental health. So it's important to know sometimes you can't help them. Sometimes they just need the professional help. You can't risk your mental health to help someone else, even though you would love to help them.
Yeah, and you shouldn't feel guilty about that either. Sometimes people just need professional help, and that's totally okay. You don't want to run the risk of, trying to help someone turning into a toxic relationship. You always need to be there for yourself. It's whenever you're on a plane, they say put on your oxygen mask first. The same thing is you can't help someone with their mental health whenever you're struggling personally. So it's really important that you encourage those family members and those friends who are struggling to get professional help as soon as they possibly can. Okay, so far we've talked about how mental health can affect our physical health, the stigma around mental health, how it affects our grades in our school, as well as how it can affect our friendships and relationships and family life. So now we're going to jump into, what are some resources that we can do to help our mental health, and what are some of the pros and cons of those resources?
In fact, research has shown that nearly 50% of those diagnosed with mental illness actually receive treatment.
So one of the reasons why many people don't actually receive treatment is due to the negative stigma surrounding mental illnesses and mental health in general.
Clinicians are susceptible for falling for the stigma, and to 2016, a study by the American Journal of Psychology discovered that clinicians are more likely to blame their patients for their symptoms of mental illness when they ignore the biological causes for mental illnesses.
And treatment is often a hit or miss. Doctors have to guess on which medication will work best, and sometimes it can be harmful.
So next we're going to be talking about some of the pros and cons of therapy. So some of the pros are that it can give people a chance to talk to someone when usually they don't have the people or resources that they need to talk, so they don't feel like a burden. So some people feel like they can't talk to their family or their friends about it, and this is literally their job to talk about it.
Yeah, it's super great because these are trained professionals, so they're able to help you recognize some traits or habits that you have that aren't improving your mental health, and they can also kind of guide you in the right direction of ways to change your mindset or really good tips and tricks on how to deal with your mental health. And because it's just a one-on-one session typically, they can work with you for customizing a plan that works really well for you. But there is a downside, and that is the fact that it can be really expensive, especially if you don't have a good insurance company that wants to help you out with that.
Some alternatives can include counseling at school or BetterHelp. But the issue about BetterHelp is that it's online, so it can be harder to find the right person for you. So moving on from therapy, we're going to talk about another resource, which is mental hospitals, which are usually used in more urgent cases. So one way people can get treatment for mental illness is through psychiatric hospitals.
How do you know if a psychiatric hospital is the right treatment for you?
Well, they're usually for more urgent cases such as extreme aggression, suicidal ideation, and excessive substance abuse.
I've heard a lot of bad things about mental health hospitals, especially on TV. Is it really like that?
Well, this experience affects different people in different ways, so this is based on my personal experiences. Going to a mental hospital can have many benefits. You're separated from any stressors in your daily life, and you get treatment that is thoroughly thought out and monitored closely. However, there are also lots of negatives.
Like what?
It can be very scary to be separated from loved ones and thrown into confronting your problems head on. You have to be willing to work with the staff to get what you need from it. Personally, I gain more good than bad from being admitted, and I would recommend it to anyone who's really struggling from a mental illness.
So if you're looking for specific resources to get started on improving your mental health today, or you know someone that needs to improve their mental health, and you live locally here in Boone County, FACE is a great program agency to go through. It's local and it focuses on improving access to high-quality social, emotional, and behavioral health services for all of you, all the way up to age 19. And their families who live in Boone County. They offer 6 free counseling visits to students and families in Boone County.
Columbia Public Schools can also help students gain access to other programs that require referrals. Students or parents should hesitate to contact their in-school counselors.
Another great resource is the Missouri Crisis Hotline, which has both a phone and text services. Call 1-888-761-4357 or text HAND, HAND, to 839-863.
Some other options that you can do online that aren't necessarily local are BetterHelp and other online therapies. This was the BHS Wake Up Interact podcast. You can follow us on Instagram at wakeupbattle_, comment on what you heard on our Padlet board, or email us at battlewakeup@gmail.com. We will link all of this information in the comment or description below with the show notes.
And before we go, we'd like to extend a warm thank you to our audience and for those supporting the podcast, like our adult sponsor, Mr. Luckman and Mrs. Lang, and our Interact groups at Rotary, Sunrise Southwest, and Metro Rotary.
Wake up, speak up, podcast.